NCLEX Q&A Daily Practice. Part 8. 1. While assessing an Rh-positive newborn whose mother is Rh-negative, the nurse recognizes the risk for hyperbilirubinemia. Which of the following should be reported immediately? A. Jaundice evident at 26 hours. B. Hematocrit of 55%. C. Serum bilirubin of 12 mg. D. Positive Coombs test. 1c. The elevated bilirubin is in the range that requires immediate intervention, such as phototherapy. At a serum bilirubin of 12 mg, the neonate is at risk for the development of kernicterus or bilirubin encephalopathy. The provider determines the therapy appropriate after reviewing all laboratory findings. 2. A young adult male has been diagnosed with testicular cancer. Which of these statements by this client would need to be explored by the nurse to clarify his understanding? A. This surgical procedure involves removing one or both testicles through a cut in the groin. My lymph nodes in my lower belly also may be removed. B. I have a good chance to regain my fertility later. However, if I am concerned, I can have my sperm frozen and preserved, cryopreserved, before chemotherapy. C. If I have cancer at stage 3, it means I have less involvement of the cancer. D. After the surgical removal of a testicle, I can have an artificial testicle, prosthesis, placed inside my scrotum. This artificial implant has the weight and feel of a normal testicle. 2c. Stage 3 is the most extensive involvement of cancer with any type. 3. During the beginning shift assessment of a client with asthma who is receiving oxygen per nasal cannula at 2 liters per minute, the nurse would be most concerned about which unreported finding? A. Pulse oximetry reading of 89%. B. Crackles at the base of the lungs on auscultation. C. Rapid shallow respirations with intermittent wheezes. D. Excessive thirst with a dry cracked tongue. 3c. Of the given findings, this has the greatest risk for potential complications. Shallow and rapid respirations may indicate that the client is losing muscle strength required to breathe. The intermittent wheezes could be an indication of an increase in narrowed small airways and a worsening condition. 4. A Hispanic client confides in the nurse that she is concerned that staff may give her newborn the evil eye. The nurse should communicate to other personnel that the appropriate approach is to A. Touch the baby after looking at him. B. Talk very slowly while speaking to him. C. Avoid touching the child. D. Look only at the parents. For A, in many cultures, an evil eye is cast when looking at a person without touching him. Thus, the spell is broken by touching while looking or assessing. 5. The nurse is caring for a client on mechanical ventilation. When performing endotracheal suctioning, the nurse will avoid hypoxia by A. Inserting a fenestrated catheter with a whistle tip without suction. B. Completing suction pass in 30 seconds with pressure of 150 mm of mercury. C. Hyperoxygenation with 100% O2 for 1 to 2 minutes before and after each suction pass. D. Minimizing suction pass to 60 seconds while slowly rotating the lubricated catheter. 5c. Administer supplemental 100% oxygen through the mechanical ventilator or manual resuscitation bag for 1 to 2 minutes before, after, and between suctioning passes to prevent hypoxemia. 6. A client is admitted for COPD. Which findings would require the nurse's immediate attention? A. Nausea and vomiting. B. Restlessness and confusion. C. Low-grade fever and cough. D. Irritating cough and liquefied sputum. 6b. Restlessness and confusion. Respiratory failure may be signaled by excessive somnolence, restless, aggressiveness, confusion, central cyanosis and shortness of breath. When these findings occur, arterial blood gases, ABGs, should be obtained. 7. A hospitalized child suddenly has a seizure while his family is visiting. The nurse notes whole body rigidity followed by general jerking movements. The child vomits immediately after the seizure. A priority nursing diagnosis for the child is A. High risk for infection related to vomiting. B. Altered family processes related to chronic illness. C. Fluid volume deficit related to vomiting. D. Risk for aspiration related to loss of consciousness. 7D. The tonic-clonic seizure appears suddenly and often leads to brief loss of consciousness. The greatest risk for the child is from airway blockage, as might follow aspiration. 8. A 6-month-old infant who is being treated for developmental dysplasia of the hip has been placed in a hip spica cast. The nurse should teach the parents to A. Gently rub the skin with a cotton swab to relieve itching. B. Place the favorite books and push-pull toys in the crib. C. Check every few hours for the next day or two for swelling in the baby's feet. D. Turn the baby with the abduction stabilizer bar every 2 hours. 8C. Check every few hours for the next day or two for swelling in the baby's feet. A child in a hip spica cast must be checked for circulatory impairment. The extremities are observed for swelling, discoloration, movement and sensation. For children beyond the neonatal period, traction and/or surgery followed by hip spica casting are usually needed. 9. The nurse is teaching a client with cardiac disease about the anatomy and physiology of the heart. Which is the correct pathway of blood flow through the heart? A. Right ventricle, left atrium, left atrium. B. Left ventricle, right atrium, right atrium. C. Right atrium, right ventricle, left atrium, left ventricle. D. Right atrium, right ventricle, left ventricle. 9C. Right atrium, right ventricle, left atrium, left ventricle. This is the pathway of blood flow through the heart. 10. Which of these tests would the nurse expect to monitor for the evaluation of clients aged 18 and older with poor glycemic control? A. A glycosylated hemoglobin, A1C, should be performed during an initial assessment and during follow-up. Assessments, which should occur at no longer than 3-month intervals. B. A glycosylated hemoglobin is to be obtained at least twice a year. C. A fasting glucose and a glycosylated hemoglobin is to be obtained at 3 months intervals after the initial assessment. D. A glucose tolerance test, a fasting glucose and a glycosylated hemoglobin should be obtained at 6-month intervals after the initial assessment. 10A. The American Diabetes Association, ADA, recommends obtaining a glycosylated hemoglobin during an initial assessment and then routinely as part of continuing care. In the absence of well-controlled studies that suggest a definite testing protocol, expert opinion recommends glycosylated hemoglobin be obtained at least twice a year in patients who are meeting treatment goals and who have stable glycemic control, and more frequently, quarterly assessment, in patients whose therapy was changed or who are not meeting glycemic goals. The goals for persons with diabetes define the target A1C level as less than or equal to 6.5% or less than 7%. American Association of Clinical Endocrinologists / American College of Endocrinology, AC/ACE, recommends that a glycosylated hemoglobin be performed during an initial assessment and during follow-up assessments, which should occur at no longer than 3-month intervals. Most would agree, however, that an A1C level greater than 9% is poor control for all patient types. 11. The nurse is assigned to a client with Parkinson's disease. Which findings would the nurse anticipate? A. Non-intention tremors and urgency with voiding. B. Echolalia and a shuffling gait. C. Muscle spasm and a bent-over posture. D. Intention tremor and jerky movement of the elbows. 11B. Echolalia and a shuffling gait. Clients with Parkinson's disease have a very distinctive gait with quick short steps, shuffling, which may increase in speed so that they are unable to stop. They also have echolalia, which means the repeating of phrases or words that are directed to them during conversation. In the other options, only one of the findings is associated with Parkinson's disease: non-intention tremors, bent-over posture, and the cogwheel or jerky movement of the elbows. 12. During the care of a client with Legionnaire's disease, which finding would require the nurse's immediate attention? A. Pleuritic pain on inspiration. B. Dry mucous membranes in the mouth. C. A decrease in respiratory rate from 34 to 24. D. Decrease in chest wall expansion. 12D. Decrease in chest wall expansion. The respiratory status of a client with this acute bacterial pneumonia, known as Legionnaire's disease, is critical. Note that all of these findings would be of concern. The task is to select the priority. Chest wall expansion reflects a possible decrease in the depth and effort of respirations. Further findings of restlessness may indicate hypoxemia. If these occurred, the client may then need mechanical ventilation. Option A is expected with such infections of the lung. Option B indicates dehydration, which may result in 13. Which finding would be the most characteristic of an acute episode of reactive airway disease? A. Auditory gurgling. B. Inspiratory laryngeal stridor. C. Auditory expiratory wheezing. D. Frequent dry coughing. 13C. In an acute episode of reactive airway disease, breathing is likely to be characterized by wheezing on expiration. This sound is made as air is forced through the narrowed passages and often can be heard by the naked ear without a stethoscope. 14. The school nurse is called to the playground for an episode of mouth trauma. The nurse finds that the front tooth of a 9-year-old child has been avulsed, knocked out. After recovering the tooth, the initial response should be to A. Rinse the tooth in water before placing it in the socket. B. Place the tooth in a clean plastic bag for transport to the dentist. C. Hold the tooth by the roots until reaching the emergency room. D. Ask the child to replace the tooth even if the bleeding continues. 14A. Rinse the tooth in water before placing it in the socket. Following avulsion of a permanent tooth, it is important to rinse the dirty tooth in water, saline solution or milk before reimplantation. If possible, replace the tooth in its socket within 30 minutes, avoiding contact with the root. The child should be taken to the dentist as soon as possible. 15. At a routine health assessment, a client tells the nurse that she is planning a pregnancy in the near future. She asks about preconception diet changes. Which of the statements made by the nurse is best? A. Include fibers in your daily diet. B. Increase green leafy vegetable intake. C. Drink a glass of milk with each meal. D. Eat at least 1 serving of fish weekly. 15B. Increase green leafy vegetable intake. Folic acid sources should be included in the diet and are critical in the preconceptual and early gestational periods to foster neural tube development and prevent birth defects such as spina bifida. 16. A 67-year-old client is admitted with substernal chest pain that radiates to the jaw. The admitting diagnosis is acute myocardial infarction, MI. The priority nursing diagnosis for this client during the first 24 hours is A. Constipation related to immobility. B. High risk for infection. C. Impaired gas exchange. D. Fluid volume deficit. 16C. In the immediate post-MI period, impaired gas exchange related to oxygen supply and demand is a major problem. 17. The nurse is caring for a client with status epilepticus. The most important nursing assessments of this client is /R. A. Intravenous drip rate. B. Level of consciousness. C. Pulse and respiration. D. Injuries to the extremities. 17B. Level of consciousness. Cerebral blood flow undergoes a 250% increase during seizure activity, depleting oxygen at the neuronal level. Cerebral anoxia may result in progressive brain tissue injury and destruction. The nurse should monitor the client's level of consciousness continuously. Even when seizures are controlled, the client may be unconscious for a while. 18. Which tasks, if delegated by the new charge nurse to unlicensed assistive personnel, UAP, would require intervention by the nurse manager? A. To help an elderly client to the bathroom. B. To empty a Foley catheter bag. C. To bathe a woman with internal radon seeds. D. To feed a 2-year-old with a broken arm. 18C. To bathe a woman with internal radon seeds. A client with internal radiation is complex care and not suitable to be assigned to a UAP. Additionally, the client would not receive a complete bath because of the radiation risks. 19. The nurse is assessing a newborn the day after birth. A high-pitched cry, irritability and lack of interest in feeding are noted. The mother signed her own discharge against medical advice. What intervention is appropriate nursing care? A. Reduce the environmental stimuli. B. Offer formula every 2 hours. C. Talk to the newborn while feeding. D. Rock the baby frequently. 19A. Reduce the environmental stimuli. This newborn appears to be withdrawing from substances taken by the mother before its birth. Reducing noise and light will reduce the central nervous system responses to stimuli. 20. An 82-year-old client is prescribed eye drops for treatment of glaucoma. What assessment is needed before the nurse begins teaching proper administration of the medication? A. Determine third-party payment plan for this treatment. B. The client's manual dexterity. C. Proximity to healthcare services. D. Ability to use visual assistive devices. 20B. The client's manual dexterity. Inability to self-administer eye drops is a common problem among the elderly due to decreased finger dexterity.